Today we will be talking to you about the Americans with Disabilities Act. So what is the ADA? It's a civil rights law that prevents discrimination of individuals with disabilities, including jobs, school, and public life. It was signed into law in 1990. To be protected by the ADA, an individual must have a disability or a relationship with somebody who has a disability. The ADA defines this as a person who has a mental or physical impairment that substantially limits one or more major activities of life, or a person who has a history of such impairment, or a person who is perceived by others as having such an impairment. It has 5 titles. The first is employment, second is state and local government, the third is public accommodations, fourth is telecommunications, and the fifth is miscellaneous. The employment title allows people with disabilities to have equal employment opportunities. Employers must provide reasonable accommodations to applicants and employees as needed. This title is controlled by the U.S. Equal Employment Opportunity Commission, and it's important to note that if a business has less than 15 people, it does not have to comply. The state and local government title allows access and use of all programs, activities, and services of public entities to individuals with disabilities. This title is controlled by the U.S. Department of Justice. The public accommodations title prevents discrimination of people with disabilities. It lays out regulations for accommodations for both existing places and places that will be constructed. It is also controlled by the U.S. Department of Justice. The telecommunications title demands internet and telephone companies provide services that allow people with hearing and/or speech disabilities to communicate with a telephone. In addition, closed captioning must be available for public service announcements that are federally funded. The Federal Communication Commission controls this title. The miscellaneous provision title has a much broader spectrum. The ADA describes this title as containing a wide variety of provisions relating to ADA as a whole, including its relationship to other laws, its impact on insurance providers and benefits, and illegal use of drugs. It also has a list of certain conditions that are not to be considered as disabilities. So who does the ADA cover? A constant criticism of the ADA is that it leaves too much uncertainty for employers and too much for the court to decide the meaning of the law, as the ADA does not set forth an executive list of the conditions covered by the ADA. The ADA does define an individual with a disability as someone who has a physical or mental impairment that substantially limits one or more major life activities, has a record of such impairment, or is regarded as having such impairment. So what are physical and mental impairments and major life activities? A physical or mental impairment is any physiological disorder or condition, cosmetic disfigurement, or anatomical loss affecting one or more of the body systems, or any mental or psychological disorder. Examples of body systems such as neurological, respiratory, and cardiovascular, and mental and psychological disorders such as mental retardation, organic brain syndromes, and certain learning disabilities. Major life activities include things such as caring for yourself, walking, eating, sleeping, reading, communicating. When you think of major life activities, you also want to include the operations of major bodily functions, such as going to the bathroom or reproductive functions. A few examples of conditions typically covered include diabetes, HIV, cancer, mobility impairments requiring the use of a wheelchair, MS, depression, completely or partial missing limbs, or conditions such as autism and schizophrenia. Conditions not covered include things such as homosexuality, compulsive gambling, pedophilia, pregnancy, personality traits, obesity, conditions that are short-term such as cold and flu, and individuals engaging in illegal drug use.
So who enforces the ADA? Like we said earlier, the Equal Employment Opportunity Commission enforces regulations that cover employment, which is also Title I. The Department of Justice enforces Title II, which are the regulations governing public accommodations in state and local government services. The DOJ also has a section called the Architectural and Transportation Barriers Compliance Board, or the Access Board. They're responsible for Title III, to ensure that buildings, facilities, and transit vehicles are accessible to those with disabilities. Next, the Federal Communications Commission is responsible for Title IV, which is telecommunications services. The Department of Labor's Office of Disability Employment Policy, or the ODEP, doesn't necessarily enforce the ADA, but it plays a major role in providing the publications and other technical assistance on the reasonable accommodations for those individuals who are covered by the ADA. This includes adjustment to a job, work environment, or the way things are usually done that would allow an individual with a disability to apply for a job, perform job functions, or enjoy equal access to benefits available to other employees.
In order for an individual with a disability to get accommodations through his or her employer, a request must be submitted to the manager. The request can be made by the individual, a family member, a health professional, or another health representative. The manager will then forward the request to the Disability Project Manager as soon as possible. A DPM is a member of the Human Resources team that acts as the liaison between the supervisor and the employee. The DPM must contact the employee within 10 days to discuss the nature of the problem that is generating a request, how a disability is prompting the need for an accommodation, and alternative accommodations that may meet the individual's needs. If the disability is not obvious or is not already known to the employer, the DPM may request medical documentation confirming a covered disability that requires accommodation. All medical information must stay confidential. A response to the request must be provided within 30 days, either a denial with an explanation of why the request was rejected, or an approval with an explanation of the accommodations granted. If the individual is not satisfied with the resolution, he or she may submit an informal dispute and request reconsideration within 10 business days of the decision.
So how does the ADA affect us as PAs? Well, we need to make sure that people with disabilities have equal access to healthcare. So we need to make sure we remove physical barriers, provide effective communication, and make reasonable modifications. In order to comply with the ADA for those who have disabilities, we need to make sure there's no physical barriers in the way. That means providing a clear floor space and making sure that people can get in and out of the exam room in a fashionable manner, and also having one exam table that has adjustable height for transfers. In order to effectively communicate with our patients who have disabilities, we need to make sure we provide services for those who have vision, hearing, or speech disabilities. As clinicians, we must determine the type of auxiliary aid that is needed to ensure effective communication with our patient before their visit. A patient must not be required to bring another person to interpret for him or her, including a family member or minor. A family member can be used if the patient requests them, the accompanying adult agrees, and it is deemed appropriate. If using VRI, which stands for Video Remote Interpreting, our supervisors must ensure high-quality images and clear transmission of information through adequate training of its users. A person also cannot be charged for the use of an interpreter or other services needed for effective communications. When providing care to a person with a disability, we may need to make some modifications to policies, practices, and procedures. Examples of modifications include allowing the use of power-driven mobility devices unless they cannot be operated safely. Also, people may use service animals such as dogs. Miniature horses can also be used if it has been individually trained to do work or perform tasks for the benefit of the individual with the disability. Also, they are very cute. Training is extremely important. The person or group which we work for should provide training on proper transfer techniques to avoid injuries and keep our patients safe. As PAs, we should be on the lookout for updated and current ADA policies and procedures to provide those with disabilities the best care possible.